Hey Daryl, where are we going?
We are going for a little drive. I've got my Nespresso in the cool new travel mug, and we're going for a drive.
Yeah, but where are we going?
Yeah, I thought you were going to ask that. I'm going to go and have a little bit of a procedure done.
Oh, what kind of procedure?
I don't know. You're going to not like me after I tell you this. Going to have, let's say, a little touch-up, shall we?
Little touch-up, eh?
Male cosmetic enhancement.
Wow! Ooh. That's not something you hear often.
No. Every man could use a little bit of enhancing.
Yes.
What are we having enhanced?
I think we are going to delve into the ugly yet satisfyingly addictive world of Botox.
Oh, they're gonna stick a needle in your face?
Yeah, that's why I wore my light-colored shirt here, so I could highlight the blood, courtesy of Explosive Fibers. Nice shirt.
It's a nice shirt.
Thank you, thank you. Getting Botox put in my face. See this? My angry look?
Yeah.
Well, I'm happy right now. Even though it looks like I'm angry, I'm left with this all the time.
Now that you mention it, you do always look angry.
And now the problem's going to be when I want to look angry, I'm not going to be able to. I'll just have that, oh, shit, surprised look on my face.
Aha.
Now, I have not had a consultation. The guy has not looked at me. This is coming from a referral. We'll put all the links down in the description. So if you guys want to go and check it out, make sure you do so. And shoot me a comment. Let me know if you think I'm absolutely batshit crazy or if this might in fact be a good idea. See, we're shooting it today, but from what I understand, you have to wait a little while for the effects kind of to kick in. Is that right?
Yeah, they say it takes approximately 2 weeks to really see the results from Botox.
2 weeks. Okay,
Yeah.
So we'll have to wait to release this video. Well, we'll ask the good doctor what he says, and then we can post, well, we've got the before, which we'll show you right about here. And then we will show you the after and put them side by side, and we'll let you know how much it costs, how long it lasts, how I felt, whether I cried like a little stuck-up little baby, or whether overall it was a good experience or not. What are your thoughts?
What are my thoughts on Botox?
For men, it's not typically a guy thing to do. Women, yeah, women, but guys, see, I don't mind the forehead wrinkles. I think they kind of make you look a little bit rugged.
Yeah.
But you know, the angry look all the time, I don't want to look angry.
I think that if you want to maintain that really nice, relaxed, restful look, you know, I think that's a good idea. But if you're looking to completely reverse the aging, then I think that's when people go too far with it.
So I can say I'm 55, so I can't really go in there and say, hey, make me look 25 or something like that.
Exactly.
It's probably a little bit
unrealistic, I think.
Unrealistic.
And I think that's when the results start to look very extreme.
But I imagine here's the problem. This isn't obviously a permanent thing. It only lasts, from what I understand, maybe a few months. Guys probably even less because their facial muscles are a little bit more stronger and what have you.
That's a good point, yeah.
And with working out, so I imagine you probably have to get it done more frequently. So then you've got to weigh the costs over the frequency to, you know, if it's something you want to do all the time or you just want to do it for a special occasion. Like, I don't think we have any special occasions. We have a special occasion coming up.
We sure do.
What's that? Anniversary!
That's tomorrow, but your results won't be ready for tomorrow.
Oh, that's great. So I'm gonna
you didn't time that right.
I'm gonna go to dinner looking angry. Angry at the bill, angry at my dessert, angry at the meal.
Right?
Angry with you YouTube fans. Just angry with everybody. So we are about 5 minutes away from the clinic in the lovely, can you shoot a shot of that bridge there?
Yeah, I can for sure. This is the lovely Lethbridge,
Alberta.
Look at that view. This is on the Whoop Up.
On the Whoop Up. The Whoop Up.
Whoop Up.
It is 10:45 a.m. on a Thursday morning.
And look at the traffic, everyone.
Heavy traffic.
Heavy traffic on the Whoop Up Drive.
And we are a balmy minus 13 degrees Celsius.
But sunny and blue skies.
Lethbridge fact, most days of sunshine per average.
Oh, sorry.
Per average in Canada. 300 and some odd days of sunshine a
Yeah.
year. Cold as hell, mind you, but
It's
sunshine.
very pretty out here.
All right, we'll kick this off and we will resume at the clinic. We'll see you there.
See you soon.
Ciao.
There, health enthusiasts. Today, I'm diving into a topic that's gaining traction among men, Botox. Yep, more guys are hopping on the Botox train, and for good reasons. Let's start with the pros. First off, Botox can smooth out those pesky wrinkles and fine lines, making you look refreshed and youthful. It can also help with excessive sweating, a lesser-known benefit that's a game changer for many men. Plus, a little boost in confidence never hurts, right? Now let's dig into the cons. Botox isn't a permanent solution, so you'll need repeat treatments every few months. It can also be pricey, depending on where you go and how much you need. Another downside? Some guys might experience minor side effects like bruising or swelling at the injection site. But don't worry, these usually fade away quickly. Lastly, let's talk surprises. Did you know Botox has been used to treat migraines? Yep, it's not just for looks. Also, the stigma around men getting Botox is fading fast. More and more dudes are embracing it as part of their self-care routine. So, is Botox for you? That's a personal choice, but now you're armed with the facts to make an informed decision. Remember, always consult with a certified professional before undergoing any cosmetic procedure. If you found this helpful, hit that like button and subscribe for more health tips and insights. Catch you next time.
We're here. Modern Aesthetics. Gonna get this little angry thing taken care of. I think he's probably gonna maybe recommend that I get some fillers or something like that. I don't know. It sounds like you go in with one price and you come out with another price and you can't even look pissed off because it's all fixed up. So let's go inside and see what they have to say. Alright, we're heading back. Oh, jeez. Now, should I feel nervous?
No.
Should you feel nervous?
Maybe.
Have you done this before?
Once or twice.
Well, tell the folks who you are.
Okay. I'm Bradley. I'm the owner of Modern Aesthetics here. And, yeah.
Simple as that.
Yeah.
We're going to do a little bit of, well, what are we going to do? See
We
how
do a little bit of, so there's Botox and Dysport.
Am I the only one that didn't know there's a difference between Botox and Dysport? Botox and Dysport both smooth out those pesky wrinkles, but they aren't identical twins. Botox is the classic choice, known for its precision and lasting about 3 to 6 months. Dysport, on the other hand, spreads a bit more, making it great for larger areas like the forehead, and it kicks in a bit faster, around 2 to 5 days. So what's best for you? If you're looking for that sharp, refined look, Botox might be your go-to. Want quicker results and a natural spread? Dysport could be your best buddy. Remember guys, it's all about what suits your style and needs. Time to smooth out those lines and feel confident. Stay awesome!
Generally in men, especially men that are into fitness and stuff like that, Dysport lasts a little bit longer.
What's the difference?
One is on a botulinum toxin, one's botulinum toxin A. It's the same thing. It's basically Chevy and GMC. Just
Yeah.
depends on your preference.
As long as it's not Chevy and Ferrari.
Yeah.
Sounds like-
Okay, so you like the GMC
Sounds like
product.
I'm walking
okay.
home.
Yeah.
So what can I expect here?
So Dysport I like a little bit better, kicks in a little bit quicker. Some people love the feel. I always explain like Botox feels like there's like hairspray on your forehead, like feels taut.
Yeah.
But I find that people that are into fitness, and men especially, they burn through it faster than Dysport.
How fast is fast?
You do fitness like every single day, right?
Pretty much.
Generally, we say that it lasts about 3 months. With you, it'll probably last 8 weeks, 8 to 10.
Alright.
It's probably what I
Nice.
would bank on. Yeah, you still should get 2 months out of it.
So will it take away the I look angry at everybody type of thing?
That's the plan. Yeah.
So when do fillers come in where Botox doesn't cut it?
So fillers is going to be when you want to revolumize an aspect. So that's kind of where you see it, like in the lips, or I call it restoring volume. Some people augment and make things bigger than they need to be. I personally am a firm believer in just restoring volume. So like in women, one of the first places they age is medial cheeks. And especially when you lose weight or you're in fitness, you'll find in men as well that it starts
As you lose fat,
you lose fat
face
there.
gets sunken in.
Exactly. So then we use filler, and there's different densities of filler. So I have one that is like the density of fat that I would place in the medial cheeks, and it kind of just lifts that tissue up. Doesn't look like you have big cheeks, but just restoring volume that's lost with
And how long
aging.
does that last?
Generally a year and a half.
Oh, really?
Again,
much-
because you're into fitness, you'd burn through it pretty quickly.
So you would do both. You would do the Botox plus the filler.
Yeah, so Botox is going to be for fine lines and wrinkles. Basically, it's like, it just relaxes the muscle. So these lines are created because you're lifting your brows. If I do Botox in there, you won't be able to lift your brows anymore, which then in turn softens those
So
lines.
I can't look you mad even if I want to.
Exactly,
So
exactly.
when does it kick in? Like when would you notice 100%?
We say full effects in 14 days. I find that it starts to kick in 5. Dysport does personally.
Yeah.
Botox, about 10 days you start to feel it. Dysport kicks in a little quicker.
So how do you determine how much I need?
Honestly, it comes down to experience. Like I've been doing this for about 7 years now.
So it's not your first time.
No, I do it all day, every day. It's my
remember your
full-time
first
job. I do, yeah, I do remember my first time. But I actually, I'm the director of education for one company in neuromodulators, which is Botox, different brand, and then I teach the Botox Canada course. So kind of helping people not make the same mistakes I had to make when I first started, because there wasn't really, it was still kind of new for nurses to be doing it. So I had to kind of figure out things the hard way. So my job now is to help people not figure out things the hard way. So over the years, I've kind of found that I can look at a forehead and be like, this is what I'm thinking. And then in 2 months, if you're like, Brad, it wore off like in 6 weeks, then that means I need to increase your dosage for the next
So
time.
more equals longer.
Yeah, dosage equals duration usually, to an extent. If you overdo it, then you're gonna be really heavy, right? So we try to find that middle ground of not feeling heavy, but that you're getting enough that you have the longevity.
So how does the price differ from one place to another? Is it just the application?
Experience. Like I have 2 other nurse injectors here that they charge $1 less a unit than me. They've trained under me. You're getting kind of the same techniques and stuff like that. It's just because of my experience, I have kind of the critical thinking knowledge to be like, you know what, I've seen a frontalis muscle like this, like a forehead muscle. I'm going to adjust my dosage, whereas that hasn't come completely to them to be able to pick up with that. Also location, Calgary's going to charge more, the States is going to charge more.
Your overhead obviously plays into that.
Yeah, so I increased obviously inflation, stuff like that, I've increased my prices, but this year a lot of people increased again another $1. My cost on my product increased by about 20 cents.
So
I'm
what's
not
the
worried about
cost?
the extra
Your
$1.
charge is cost per unit?
Yeah.
So what's the cost per unit?
The cost per unit for Dysport is $9 and Botox is $10.
So the better one's cheaper. Is that the Dysport's the cheaper one?
Preference. It really does come down to preference. I still use a lot of Botox. Some people prefer Botox.
$9 Canadian, that's about 60 cents US or something.
Yeah. So the Botox is $100 more a vial to me.
Oh,
So I
cost to
charge,
purchase.
so
I
I
see.
charge $1 more a unit just to make up for that.
So what could potentially go horribly wrong? What's the worst case scenario for a Botox person?
I always say the most common risk of Botox is unsatisfactory results.
It's just
That
not-
something feels heavy or you don't like it, something like that. There are rare cases of people having like anaphylactic reactions, but there's more studies on Botox than there is on acetaminophen.
So any medication you could potentially get
Exactly.
that.
Headaches sometimes happens with Botox and Dysport.
Yeah.
Headaches is probably the most common one. And then unsatisfactory results of just not feeling like you like Botox. A little bit of redness to the area,
Do
stuff
you
like that
find
is
most
fine.
people come back?
Yeah.
They
Yeah.
get it done, and then it's just part of the routine.
Yep.
Just gotta keep
Yeah.
getting it.
Once.
One of those people.
Yeah. She's one of those people. Then you just book you booked the 3-month follow up before they've even gone because in 3 months they're gonna want to see you again. I have to look at our percentage this year, but we're pretty standard in having a repeat clientele.
Yeah.
Most of my clients that I've developed now, I know everything about them now. I know everybody's name.
So is there aftercare, or can you just resume your regular day?
I generally recommend not laying. Well,
That's okay. I'll just mark
for years and years, they say that you shouldn't lay flat for 4 hours and you shouldn't work out. There's actually no studies to back that up. That's just kind of what the vial says.
Yeah.
So I generally just say, hey, if you can like not push on your face, because it is a little bit malleable.
Yeah.
So just no massage to the face for.
Just let it do its thing.
Let it do its thing. I generally recommend not working out till the next day.
Yeah.
Just sleep on it.
So for all the meatheads out there, let's get into the clinical. What is the gauge and size of needle that you use?
The gauge and size, I'm using a 9mm length, 31 gauge.
So it's like an insulin syringe.
It is an insulin syringe. That's
So
what I use.
How deep are you going in?
Dysport, I'm going like subdermal.
So just right under the skin. Away you go.
Yeah, not quite superficial, more subdermal. Botox, I prefer to put it like intramuscular. I like to go deeper with Botox.
Oh, the Botox go deeper.
Yeah.
Just different activations.
Yeah, I found that Dysport works better subdermally, and Botox, Botox doesn't have the spread that Dysport has, and so you kind of need to get it right in the muscle.
Localized a little bit more.
Yeah,
So
whereas
what do you
Dysport has the
feel
spread.
when you're doing it? Is it a stinging, or what does it feel like?
Like for you,
Yeah.
kind of what it's gonna feel like. The little poke shouldn't feel stingy. I use bacteriostatic saline, which takes the sting out of it. That's what because when Botox or Dysport comes, I'll show you. Dysport comes and there's a little tablet at the bottom,
Oh, you.
and then I
reconstitute.
reconstitute it.
Okay.
Yeah.
All right. Well, let's do it.
Cool. Yeah, let's take a look.
Cheers. You get a nice free coffee.
Yeah.
Yes.
The
We
last
have a
supper
nice
coffee.
selection here. Yeah.
Who's this little? Who's
This is
little
Lulu.
patient? Lulu.
She's the therapy dog.
Lulu is a
Hi,
therapy
Lulu.
dog.
It's funny. I put that coffee machine out there because there was this is kind of funny. There was a clinic that was advertising that they had a coffee maker there, and they're like, hey, like we can now bill you for coffee, and so they had like things.
Bill
like,
you for
yeah,
coffee?
so it was like 50 cents for cream and stuff like that.
Ouch.
So that day I ordered
You
a
said
coffee
that was
machine
good to go.
and put it there and said complimentary coffee.
Hey, look at that. It's the little things. It's
Yeah.
good
It is the
coffee.
little things.
I got
Absolutely.
the maple pecan.
Yeah.
I mean, it's $1 for those capsules. I'm like, I can eat that. And but it's funny. I think more people walking by get coffee than
And
clients.
actually coming in?
Yeah.
Oh, that's pretty
Yeah.
cheesy.
Yeah.
Well, now I know you're here.
I know.
We'll make it a regular thing.
I know. Cheaper than Starbucks. Starbucks is getting too
Cheaper than
expensive.
Starbucks. You gotta sell a kidney to get Starbucks.
Oh frick! I was flying to Toronto last week, and
God, don't even tease us about that. We came from Toronto.
oh gross. And when I was there, I was like, I just got usually what I get here, and it was $10. I was like, okay, well this is my meal in a cup.
And then there's a tip on top they're looking at.
Yeah,
I believe that part started at 18%.
yeah. Have you lifted your brows for me?
Like that.
Yeah.
So what are we looking at? Is that going to do stuff for the these creases? Like what?
Yeah.
What are we working
as we
on there?
soften it, it's slowly your collagen is going to stimulate, and those creases are going to soften. The best way to get rid of creases is more like laser, radiofrequency microneedling.
I don't want to get rid of them. I don't want to. I kind of.
We just want to soften them.
Still want to look like a dude.
Yeah, we just want to soften them. Okay, let's go.
Hey. So what are we looking at out the door here?
Cost?
Yeah, unfortunately, I can't look mad at the time, so I gotta
Let
look
me
mad now.
let me mark you up here, and then I'll do the math. Have
Uh-oh.
you lift your brows for me? And relax.
It's gonna be one of these. Hey Siri, do the math.
No, I could do it in my head.
Okay, that's good.
Me and my wife just went to Japan, and tipping in Japan is
Oh no,
frowned
forbidden.
upon.
Yeah,
right?
can't do it.
Freaking loved it.
Yeah, it's
Best service. Didn't
it's
have
their
to
job
tip.
to provide you good
Yeah.
service. Here, it's an expectation, even if you do a crappy job.
Well, fun fact: there's no tip function when you're done today. So
Well, there you
don't have to worry
go.
about
I was
that.
getting a little worried about it.
Yeah. You're like, I hate tipping, and I'm like, well, just make sure you tip at the end of your service. No, I don't believe that nurses should have tip functions.
Well, it
What
kind
we're
of should be
doing,
kind
I'm
of built
using-
into the price, you know.
Yeah,
You know,
yeah. If I'm not profiting enough, I'd increase the dosage by or increase the cost
Yeah,
per unit by $1.
exactly. How many of these do you think you do in a day?
How many patients?
How many, just doing Botox or all kinds of stuff?
I do a lot of stuff. I do CO2 for resurfacing. That one has a good like week, 2 week downtime. I usually have one of those a day.
Do you do the IV?
Yep, we do IV therapy here. as well.
Oh, nice. Glutathione?
Yep, glutathione as well as NAD.
Nice.
Those are kind of the two
There,
most
you
popular
heard it here.
ones.
Probably not too many places in Lethbridge where you can get that done.
I don't know if there is any besides naturopaths. There's
I've
some
heard of a
naturopaths that do
pre-workout
it, too.
one. I've seen that on YouTube before. The guys are doing a pre-workout IV drip. Have you heard of that before?
Yeah, it's more common in the States. Is kind of a
It's a
dog
bit
eat dog world out there. They're doing so many wild things.
Just all, it's like the Wild
we haven't
West.
caught up. Yeah,
The
we haven't
Wild
caught up
West
to
of
that.
IV, peptides, you name it.
Exactly. Yeah, peptides aren't big in Canada yet, where they're huge in the aesthetic world
Huge.
down there. Lift your brows again for me. And furrow.
That's that. That's a furrow.
Yeah.
I think I do that automatically.
18.
You're just doing a lot of counting there. I'm starting to get concerned.
Yeah, you got a lot there, hon.
Got a lot?
You do, yes. A lot of red dots.
So you're gonna have 42 units. So times that by 9. plus 5%.
378.
Yeah. 396 out the door.
Well, that's not bad. Again, Canadians, so before they jump all over us, they're $400. It's Canadian.
Well, that being said,
That was at
my-
40% less in the US.
Yeah, and in the U.S., the average cost is $12 to $18 a unit.
Now, can I go online and from Alibaba and just grab some Botox online and do this myself?
I would love to see what it looked like after.
Because you know there's people doing it.
Oh yeah,
100%. Yeah.
yeah. There's I had someone come in the other day that had a migration of filler, and they didn't tell me where they had it done.
What's that mean?
Like
It
the filler had shifted behind
moved?
the lips. Yeah.
Oh, no.
So I was like, hey, before I touch your lips, I want to dissolve it all.
How do you do that?
So hyaluronic acid is what we inject into your lips, and then there's a product called hyaluronidase that breaks down.
Oh, it just
that
does the
product.
reverse?
Exactly. So it just kind of melts it.
Oh, so in
Yeah.
case you put it in the wrong spot, you can kind of do
Exactly.
a do-over.
That's the good thing about filler is if you're ever not happy with it, you can dissolve it. Botox, if you're not happy, you kind of gotta
You just
wear it
gotta
off
wear
for
it.
a few months.
You just
Yeah.
Wait.
gotta gut it out.
Yeah, so I went through 2 dissolving sessions on her, and not one thing dissolved. And I found out that she got it done by somebody that wasn't registered.
Oh,
and I'm
no.
like, so it
Wasn't the product she
wasn't
thought?
hyaluronic acid. It was some sort of like semi-permanent filler. So she's like, so what do we inject now? I'm like, you go see plastics.
Have you
and
heard
it
of those
surgically
before? They're like
removed.
little beads of like plastic.
Yeah.
Bodybuilders are putting them into muscles to volumize their muscles.
So she has to go to a surgeon to get it surgically removed?
Yeah,
Oh,
because I was like, I'm
wow.
trying to dissolve this, and
Because it starts adhering to tissue, right?
yeah,
Ouch. Yeah, you gotta get that shit cut out. It's the Brazilian butt lift gone bad.
yeah, yeah. This industry's wild.
How long does it take to learn how to do Botox before you're like out the door ready? You already have a background doing it, medical and all that stuff anyway.
Yeah, I kind of laugh because I find that the most confident I ever was doing Botox was my first day out of the course, because I was like, oh, this is how you landmark, this is how you dose. it's
You're
great.
just learned right up.
Yeah, right. And then you get all of these 2-week follow-ups, and you're like, that didn't do what I thought it was gonna do. So I think my confidence in injectables kind of goes like this throughout the years.
So
because
learn as you go.
Yeah.
Yeah.
Is anytime you think you know what you're doing, all of a sudden a new study comes out and all of a sudden you change things, right? Like for instance, injecting Botox, it was supposed to be deep, and then they said no, you need to do it superficial, and then another anatomist came out and said, hey, should we do subdermal? So the more popular it gets, the more research they're doing on it, and the more we're changing techniques, we're changing products.
Now, is there any revelation in the product itself that makes it better?
In my opinion, it's tough to say because every new product that comes out, one of the original products on the market that I'm not a huge fan of, it was a great product up until like 10 years after. They're like, hey, we're finding granulomas, and then you're seeing on Facebook like when they do the the MRIs, they're like, oh, this is sitting there 10 years later. Filler's not supposed to be there. That's those
Yikes.
older products. So some of the newer products that are hitting the market, they're like, oh, we don't cause granulomas, but they've been around for 5 years.
Yeah, let's wait another 5.
Right.
Yeah.
So I personally, I'm a big Restylane fan. It's been here comes the first spoke here. It's been around
That wasn't too bad.
just as long as like the oldest product on the
barely feel
market, with none of those findings. So I like the OG product.
Oh, that one was a little zesty.
Yeah, they get a little spicy.
Feels like my lip wants to quiver. Is that just because I'm a suck?
I find women tolerate Botox better
Oh,
than
for
men.
sure, 100% more. If men were responsible for childbirth, the world would be empty.
Oh, 100%.
There's too much pain.
I do stem cells for hair growth, and
Does that work?
I find that it's working really well. I can show you some before and afters.
But now you can get a transplant in Turkey for like $3,000 or $4,000 or something.
Yeah, that's anybody that has like significant hair loss. I'm like, go to Turkey.
Oh, it's just
Yeah,
mild
like hair
loss.
thinning and stuff like that, or like COVID-derived alopecia, stuff like that. I find that it does re-stimulate thicker follicles.
Actually get regrowth.
Mm-hmm.
It's
Yep.
not fuzzy stuff. It's
Nope. Yeah. Kind of just giving it a kickstart, but excuse me. In men, I find whenever I'm injecting them, they're squeamish. But I have a 9-year-old patient that I've been treating for a couple months now with alopecia. Well, she just handles it like a pro.
9-year-old.
Yeah, doesn't even bother her. I'll be putting needles down 2 millimeters in depth. And,
You got to throw a pile of them in there.
yeah. Oh,
That's
yeah,
got
you're
to be
injecting a
pricey.
ton.
That's got to be pricey though, no?
It's not too bad. I mean, I do pro bono
Oh, attaboy.
just because I was more interested at the time. Then I'm like, I told the mom that I was doing Botox on. I was like, hey, can I try something? I can't promise you it's gonna work. I won't charge you, but I'll show you a picture here of what we've done over the past 6 months. It's
With hair regrowth.
yeah.
Because that's big with bodybuilders. A lot of our channels, the fitness type.
Yeah.
Men will tend to lose their hair a little bit quicker due to
A lot of them go-
testosterone,
yeah.
right? So this is a possible remedy to a certain degree, or
Yeah. At least slow down the process of hair loss as well.
Yeah.
Right. There's shampoos, there's oils, or stuff like that. It's
what's the
hard
mechanism?
because
Because it's a conversion of DHT in the scalp that causes that.
one of
some
the
of the-
big, I mean, one of the things that I actually do stand by is like the dermal rollers, because any type of stimulation you're causing to the scalp, the increased blood flow, is going to help that hair growth. So we're kind of doing that as well with microneedling of the scalp. But it's basically just almost like little messengers that are sending little messengers to stimulate hair growth. PRP, PRP is good for like post hair transplants.
That's
in
when
my
you're
opinion.
using your own blood and spinning it out. And
Yeah, the
putting-
growth factors in it are pretty minuscule. You can see benefits of it, but I think that's, you're looking at like 5 million growth factors, whereas with plant-based stem cells, you're looking at about 13 billion.
Jeez,
Yeah,
that's done.
it's all done.
Did you get any in here?
Yeah.
He's quick, eh?
Wow, almost want to do it again. So
Almost.
I don't feel any different. Like it feels numb, like a little tiny bit, like little tiny pinpricks, but nothing. Like I don't want to cry yet.
Not this time. Yeah.
When I get the bill, maybe I'll
Once the
shed a
camera
tear.
turns off.
So how would you rate that? Pain? on a
Oh
scale
no,
of
there's
1
no
to 10?
pain. The
No
pain was the non-issue.
Painless.
The bill is where the pain is going to come. It's all in the bill. But then you're going to love it. I'm sure I'm going to look at it and go, wow, that's great. Then you got to
will
do it
love
again.
it.
So it's just going to be part
Yeah.
of your normal routine. So if you don't, you're going to love it. Either don't do it or prepare to commit long term, right?
Yes,
But when you've got professional people like this
absolutely.
doing it
One of the best.
with a free
Yeah.
coffee to boot,
Yep, great
come on
service.
down. We'll
Beautiful
put
clinic.
the link to the clinic in the description, so make sure you check us out. Hey, thanks for watching. Hey, I'll update you in a couple weeks. We'll see how it looks. Thanks for your help.
Yeah, absolutely.
So here we are, about a week after my big Botox procedure. And well, let me ask Antonella, what do you think?
I think there is a difference.
You see, I think the difference is, I agree.
Slight. It's slight. It's because some of those lines are a little too deep, I think.
Yeah, I think I went in there with some pretty hefty expectations. It does look, it's definitely softer,
You look more relaxed.
more relaxed. But I think with guys compared to women, I think women get much more dramatic results than men do. I don't know if I would keep it up. I probably wouldn't. You know, it cost almost $400, and I don't think it was dramatic enough for me to say, "Oh wow," you know, which would mean either one of two things. I have to use more of it, so then the price would go up significantly. And then, you know, do we want to be paying like $500 or more? You know, I'm gonna have to be happy looking angry. So for now, that's my review of Botox. Thanks for joining. Subscribe, comment if you've ever done anything crazy like this, and what you thought the results were for yourself. If you're a dude and you got Botox, you want to get in a little bit closer, you can see what's going on there. See, I can still kind of move it around a little bit.
You might
And there you
just
have it.
need more.
May just need more. Thanks so much for joining. Catch us on the next video. Cheers.